Hello, everybody. What is going on? Today is January 9th, 2023, and Happy New Year. In this video, we are going to be going over the FDA Catalyst calendar for the week of January 9th through the 15th. Now, as we scroll down, you'll see there's not much going on in terms of announcement-wise right here. It's just meetings. There's anything of real big importance with these meetings. And as they go on, they will reveal more information throughout the day. So kind of try to keep an eye out, keep up on posts with the JP Morgan Annual Healthcare Conference, see what they have to say. And then scrolling down, you'll see here we have BCEL working with ATRC 101, the monoclonal antibody. Click on that and let that load up. And they're working on a data readout for phase 1B, and that's in early 2023. So the ATRC is a monoclonal antibody derived from an antibody identified using Atreca's discovery platform. If we look into what they have going on, they have, like I said, the ATRC 101, the monoclonal antibody. Well, anywho, it's already naturally occurred in the body, and our body makes it. And what they're doing is they're synthesizing it, and they're directly injecting it into the tumor site. And you'll see as I scroll down, look at this whole list of cancers that it could possibly treat. However, the caveat for this for one of these treatments, as I scroll down, you'll also see for one of these treatments is that you need to be an adult female with inoperable, locally advanced, or a metastatic high-grade serous epithelial or ovarian, fallopian tube, or primary peritoneal cancer. And it needs to be platinum resistant and defined as progression within 6 months of the last dose of platinum-based chemotherapy, or breast cancer that is refractory to other standard therapies. But, however, the range of cancer it can possibly treat, it's quite impressive and most definitely worth looking into. The clinical trial is expected to be completed entirely in December of 2024. And then they also have an estimated study completion in March 2025. Then moving on, you'll notice that 3 of their projects are backed by pretty heavy companies. You know, they're working with the weaponization tech Zymeworks and Xencor, and the other one for their infectious disease, which if you know anything about cancer, infectious disease falls hand in hand with it because cancer, as it penetrates through other organs, it causes infection. So infectious disease and oncology, they work hand in hand. Back to the list, we have CRSP, and they're working with CTX110CD19. When we go into their pipeline, we'll see we have this hema stem cell therapy. That word, hematopoietic. Yeah, that tongue twister. They're working on phase 3 readout in the Q1 of 2023. But it's just a submission package that they're working on. And then if you scroll down, oh, and also it's the beta thalassemia and sickle cell disease. And same thing down here. But the thing is, with these different ones, we have this one, phase 3, with the Climb 141 pediatric trial. That stem cell where they modify the patient's blood as their fetus, and then they follow them around. The same thing that except for it's phase three with these two phase three data readouts. And this one is for Climb 151. And then if you go down and you'll see the CTX 110, it has an early 2023 announcement. Don't know when, and this will be just about the initiation of phase two. And this is for B-cell malignancies, blood cancer, cancer in general, and the CD19 malignancies. And if you look, finally, we also have this one on the beta thalassemia. It is phase 1-2 update, which, as we discussed in a previous video, it's just a combination of the two. So this seems promising because they are already implementing phase 1-2, and I'm looking forward to maybe seeing that they have phase 2-3, where they bring the aspects of phase 3 into the same parameters of phase 2. And yeah, so, and like I said, there's a previous video that I had just made discussing the phases. And it's not a whole lot to talk about with these guys getting into the technical information, and that's just unnecessary. That's not what we need to know. That's not supposed to be the takeaway from here on this. So the takeaway is supposed to be what's going on, the date, and yeah, stem cell. I can't explain that to you because I don't even understand it myself. So as we go along, I will be continuously checking these dates to see if they are announced and when it will be. So just stay tuned. I guess that's about it. So that wraps everything up for this video. And until next time, see ya.